Hi, my name is Sarah. I'm going to be the nurse practitioner performing a cardiac and pulmonary exam on Ryan here. So I have my patient laying down. First, I'm going to have you just kind of look to the left a little bit, and I'm going to assess for any JVP. And not note any jugular vein pulsation or jugular vein distension. So I am going to just take a feel for the carotid here. We have a nice strong carotid pulse. I do not feel any thrill, so I will listen for a bruit. Okay, and then I'm going to have you turn your neck the other way. I'm also going to examine from this angle. Sorry. Also not noting any JVP. Feel for your carotid. We have a nice strong carotid pulse. Also do not feel a thrill on this side, so I'm going to assess now for a bruit. So for this portion of the exam, I did have my patient remove his shirt. With a female, you could keep her covered, but I'm going to just take an assessment of the precordium. So I'm just going to take a look. I'm just assessing for any lifts, heaves, any pulsation that's abnormal. I'm going to just take a feel around the sternum, the apex of the heart.
Cold hands.
Just take a listen to your heart. I will listen with both the diaphragm and the bell. So first I'm going to start with the aortic, and that will be in the second intercostal space on the left sternal border. And then I'm going to move the pulmonic, which is in the second intercostal space on the right sternal border. Moving down to Erb's point, which is in the third intercostal space, left sternal border. And then we're going to go to the tricuspid, which is in the fifth intercostal space. And move over to mitral, which is in the fifth intercostal space, midclavicular. And then I'm going to listen with my bell to assess for any murmurs. And I do note a normal S1, S2. I don't note any abnormal S3, S4, or any murmurs in any of the valves of this patient. So for the next portion of this exam, it's going to be a respiratory assessment. While I already have my patient laying down, I'm going to just do an assessment of the lateral chest wall. So on the right side, I'm going to have you just lift your arm away from your body a little bit. And like straighten out. So your arm's a little bit away from your body. Just gonna take a listen here. Take a nice deep breath in. Okay, take another nice deep breath in and blow out. And then I'm going to have you kind of rotate to the other side here. And we'll move our little recording device. And do the same thing over here. I'm going to have you just kind of Rest your arm out a little bit. And take a nice listen here. All right, great. Okay, so we kind of just removed a little bit. Now my patient sitting forward. I'm just gonna take a look at his chest, looking for equal chest rise. Patient is sitting upright. I don't note any labored breathing, any audible wheezes, anything like that. Just kind of take a look at the trachea here. Okay. And take a look at the suprasternal notch right here. And then move down to the angle of Louis. Take some nice deep breaths in and out. And then for the next part of the exam, I'm going to take a listen to the lung sounds. So as my stethoscope moves, just go ahead and take another nice deep breath in and out for me.
Sure.
So starting right under the clavicle. Go ahead and kind of catch your breath there for a minute. Upon listening to lung sounds, I'm looking for like any audible wheezing, rales, crackles, bronchi, stridor, any friction rub. Just on the anterior part of the chest, I did not hear any of that, but we will also assess the posterior portion of the chest as well. So I'm going to have you kind of turn to your side here, and I will move this a little bit so we can see better. And I'm going to listen to the posterior portion of your chest here. So I'm going to do the same thing. I want you to take just deep breath whenever you feel my stethoscope move, okay? So for the next part of the exam, I'm going to have you do the same thing, but as I move through, I want you to say blue balloon. I'm going to be assessing for tactile fremitus.
Gotcha.
So say blue balloon.
Blue balloon. Blue balloon. Blue balloon. Blue baboon. Blue balloon. Blue balloon.
Okay, and that is heard equally throughout all the lung fields. For the next portion of this test, I'm going to just kind of place my fingers right under here, and I'm going to have you take a nice deep breath out, in. Great, and what we're looking for there is a nice equal chest excursion. We are equal on both sides. So I'm going to have you kind of face forward again, and we're just going to note the AP diameter, so the front of the chest to the side of the chest. And we do expect that to be 1 to 2, which he is. So the front portion of his chest is 2 times the size of the normal part, or the left side of his chest. And then for the last portion of this test, I'm just going to do some percussion over the lungs. And we do hear a nice resonance as we go over the lung sounds, which we expect to hear. All right, thank you. Bye.